ago. So it's really important, if you have not had your colon cancer screening, I would talk to your doctor. If you have first degree relative, which means parents, siblings, or children with advanced colon polyp or colon cancer, you should get screening at least 40 or 10 years younger than the age of diagnosis of your family member. If you have any other questions about, your risk and stuff, I would talk to your doctor about that, okay? There are 3 ways to do colon cancer screening. The gold standard is still colonoscopy. So colonoscopy is scary. I told my own parents to do colonoscopy, so they were horrified what it entailed. So typically they would give you this juice. It's literally like Miralax to help you poop, and you will be pooping the day before, and you will take also like a lot of like other medication. And then the day off, they give you very good medicine. They put you under anesthesia. You won't even feel or hear anything. So they put a camera up your bottom, and then they check if there's like any polyp or anything abnormal in your colon. If you have like polyp, sometimes you have one, sometimes you have multiple polyps, and they would cut them out. They will send them to pathology. They would look at it under microscope, and depending on what they found, your recommendation will be to follow for colonoscopy in 3 years, 5 years, 7 years, or if it's clean, it's 10 years. However, if you start to have like symptoms like belly pain, rectal pain, blood in your stool, anemia, or you just have like weight loss, I would talk to your doctor, because make sure that one of your cancer screening, including colorectal cancer screening, is up to date. So colonoscopy is gold standard. There are 2 other ways to also do colon cancer screening if you don't want to do colonoscopy. If you are a candidate, of course. FIT test is an annual blood test, stool test. I'm sorry. Basically, you would collect your own poop in a container. You drop it off at the lab. They check for blood. If there's blood, we don't know if it's from hemorrhoids, which are benign, which are not cancer. Unfortunately, you have to go for colonoscopy for further evaluation. The second option would be like Cologuard. So Cologuard, same thing. You get that kit. It's like receiving an Amazon package. You look at it, you collect your own poop, you put it in that little container, you ship it back. It's like returning Amazon package. Very convenient. So Cologuard is checking for blood, it's checking for abnormal DNA from like polyp, from cancer, things like that. So Cologuard, if the screening is negative, you repeat it every 3 years. If the Cologuard is positive, it can be from anything, doesn't always mean cancer, you have to go for a colonoscopy. Okay? So if you are like less than 45 and you're healthy, you don't have like family history of colon cancer, what can you do to prevent this, right? So with all cancer prevention, eating healthy fruits, vegetables, less red meat, less processed foods, get regular exercise, come to walk with a dog once a month. It's gonna like lower your risk of developing cancer. Also reduce, not smoking, not using drugs, moderate amount of alcohol or like no alcohol at all will lower your risk as well. So that's the only thing that I have about colon cancer screening. Please get screened. Whenever a patient asks me like, I have this reason or that reason, I always tell them I told my own parents to get colonoscopy. So, any questions?
Any
Did I
question?
scare everybody?
No.
Is there like a pill that you swallow, then there's a camera?
Yeah, I think there is. I'm not too familiar with that. That's something that I don't typically order in like primary care. It's something that like GI would order. If people are not candidate for like any of the testing for some reason, there is like a pill.
Okay.
Right? Yeah, like an capsule endoscopy. Great
That's it.
question.
No, you throw them away when you pass. It takes a lot of
I
pictures.
hate the drinking.
Yeah.
Juice.
Yeah.
Yeah, everybody hates it.
Oh my God, I want to bomb it all the
My
time.
mom did. She received her first kit of colonoscopy. She was like, "What do I do?"
It makes me dizzy.
My mom drink everything, every bit of it. Otherwise, if it's like they call it poor bowel prep, if there's still like poop in there when they do the colonoscopy, sometimes they'll wake you up and be like, well, it depends on how severe it is. But I've seen patients, was told like we need to do this again in like 3 years.
Yeah, might as well do it the right way the first time.
Right, the first time. Right.
Because it's not.
Or is it not part of the standard screening? If you go for an annual physical, they're not. You know, if they're just doing a blood. These days, it seems they just take blood at my annual physical, so they're not screening for this through blood tests.
So this is not a blood test screening.
So they're not screening for it then. The number three cancer.
I would ask your doctor, you know, about this because 45 and up, that's like the new recommendation now for both males and females to get this screening. So, I'm not sure. Maybe they ordered like an occult blood stool, which is a fit test that you collect your own stool sample.
No, I mean I don't. You know, it seems like the annual physical. I know my older doctor retired, and I mean his was so hands-on and did everything, and now. And I talked to a lot of people. It just seems like it's just a blood test, and
Yeah.
that's about it.
My
Yeah.
doctor made me do it. My doctor made me do it.
Yeah. But it's
Part of the
dependent or
annual- yeah, because of the age.
I guess it's
Yeah.
just different
Yeah,
doctors.
yeah. He made me do it, so I did.
Most of the time, it's recommended.
yeah,
It's
yeah,
up
on
to
the
you if
age,
you
like,
really want to do it
And I
or not,
told
but
him,
it's
yeah,
highly
is it a
recommended.
time? And he said, yeah.
and also if you reach a certain age, that
Yeah.
it was requires you at least, I don't know, because it's also is the insurance thing, you know, whether they pay for it or not. But if it's like one time that you already reached that age that you have to have it, insurance will pay for it.
Different insurance. I've dealt with different insurance, so different insurances.
Yeah, I know.
But if it's preventative and you're worried, I would try to about 13.
Yeah.
What about upper GI?
Endoscopy.
Yeah, endoscopy.
Yeah, so upper GI endoscopy is typically not like a preventative, you know, preventative thing. Yeah.
There's an ileostomy
So upper GI for like upper endoscopy, typically like when I send my patients to upper endoscopy, if it's like a heartburn that doesn't go away, like you know, like a medication like omeprazole,
Nurse Joy.
Prilosec, Nexium, things like that. If it's not getting better, if they're coughing up blood, you know, if they're sometimes even
Let's see. Hey, good morning. Just in case you're wondering, I am with my friends, walk with the dog, and we're doing some exercise, and we have a doctor invited for giving some knowledge about your health. Okay, bye bye.